Welcome to the afternoon session of the Board of County Commissioners, January 24th, 2023. Welcome back to Harris Hall. Ms. Mulcahy, howdy.
Hello.
Good to see you again. It's been a long time.
Likewise.
Then we have a fairly short agenda this morning with some pretty cool stuff. The first thing on today's agenda, this afternoon's agenda, is Public Works. We have a public hearing on Order 2301, 24-06 in the matter of surrender of 5 county roads or portions thereof to the City of Cottage Grove with a public hearing. And today, the county surveyor, Michael Blome is with us. And Ms. Mulcahy, I'll just forego asking you to introduce Mr. Blome. I just did, because we do have a script that I'll go by for today's hearing. The public hearing has been held in pursuant to ORS 373-2.270 to allow for public testimony prior to the Board of Commissioners' action approving or denying the City of Cottage Grove's request to transfer jurisdiction of certain sections of county roads to the city. If approved, the board can adopt a final order on the surrender which will transfer jurisdiction of the roads to the City of Cottage Grove. At this point in time, I will call to the Board of County Commissioners for ex parte contacts, or if you choose to abstain due to conflict of interest, I'll go from my left to my right, beginning with Commissioner Lovall. I declare any ex parte contact. Have you been talking to anybody about this outside of this meeting? So therefore, no conflict of interest. Commissioner Buck.
No, you think I would have, but no.
It's your hometown. Vice Chair Trieger.
None to declare. Thank you.
Thank you. And Commissioner Senega.
No.
And I have no conflicts of interest or ex parte contacts. Therefore, we will move forward to the public hearing. At this point, I will open the public hearing. And we'll now hear the report by staff. So, Mr. Blome, please.
Thank you. Good afternoon, Commissioners. I'm here today to present a request submitted by the City of Cottage Grove they're requesting that Lane County surrender jurisdiction of 6 sections of 5 different county roads to the city, and this is pursuant to City Council Resolution 2082, dated November 14th, 2022. Cities can request jurisdictional transfer from governmental bodies pursuant to ORS Chapter 373, which include conducting a public hearing to allow for public testimony prior to action by the board. The Board of County Commissioners, pursuant to Order 22-120604, set today's date and time to conduct the public hearing. ORS Chapter 373 also requires public notice of this hearing be published or posted. The time and date of this hearing was posted along each section of road on December 9th of 2022. The county roads selected for jurisdictional transfer are all located within the city limits of Cottage Grove, and they consist of approximately 1.47 miles of right-of-way. And they consist of the following 5 sections of road. We have a small section of Airport Road, which is County Road number 728. We have 2 segments of West Main Street, which is County Road number 2272. Sweet Lane, which is County Road number 860. North Douglas Street, which is County Road number 1220. And North Lane Street, County Road number 862. Airport Road, Sweet Lane, and the 2 segments of West Main Street have been routinely maintained by county forces, county road maintenance forces. And we had a deal with the City of Cottage Grove that if we chip sealed the roads that the city would request jurisdictional transfer, which they have done. In the case of North Douglas Street and North Lane Street, it's a little more convoluted. The city asked the survey office to provide some research to them regarding those 2 roads for an improvement project they were doing. Our research had indicated that those roads had never been formally transferred to the city, even though they've been maintaining them for a number of years. So in order to clean up the record, the city asked us to include those 2 roads. If you have the report, the formal staff report is in your packet that you have today. You'll see that the director's report, which is attached as Exhibit B to the order, the Public Works Director has recommended, and staff also recommends that the commissioners approve this action. So this concludes my report. I'll turn this matter back over to you. I'm happy to answer any questions you may have.
Thank you, Jay.
Sure.
At this point, I'm going to call for public testimony before I ask for additional comments by staff. Actually, prior to public testimony, any questions or comments from the board? Commissioner Buck.
Okay, just one comment. I did not see this in the report, but I just want to clarify, this is a circumstance where they're asking for transfer, but we don't have to upgrade the roads prior to transfer.
No.
Wonderful.
Yes, that's a good thing.
And thanks for that clarification, Commissioner. Then we'll move to public comment. First, I'll entertain public comment from those who are signed up in Harris Hall, followed by public comment from anyone who may be signed up online. And signed up in Harris Hall, we have Eric Mungan. And Eric is the only person signed up. Mr. Mungan, you'll have 3 minutes to testify. Please step to the mic, identify yourself, and the clock on the wall to my left gives you the indication.
Thank you, Chair Farr and Commissioners. My name is Eric Mongan. I'm the city planner for the city of Cottage Grove. I want to thank you on behalf of the city for considering this jurisdictional transfer request, and I want to recognize and thank Lane County staff, specifically County Engineer Peggy Kepler, County Surveyor Jay Blamay, and Engineering Associate Ben Hankey Hills for their prompt and professional service in assisting with this request. I'm available to answer any questions you may have. Thank you.
Thank you, Ms. Mungan. Anyone else in Harris Hall wish to provide testimony? I see none. Ms. Jones, do we have anyone signed up online?
Thanks, Chair Farr. I do have someone signed up. If you have signed up to give public testimony during this item, please raise your virtual hand, and I will call on you to give a testimony for this item. I am not seeing a hand go up. So looks like maybe they've just called in to listen. So I will return the meeting to you, Chair Farr.
And thank you, Ms. Jones. I'll ask in Harris Hall once again, anybody else in Harris Hall wish to provide testimony? I see nobody. I will then close the public hearing. And let's have some discussion among the board. If there is any, I'll look to a queue. I think you've been pretty thorough, Jay. So with no further discussion, I will entertain a motion. Commissioner Buck.
I move to approve the public hearing and order 23-01-24-06 in the matter of surrender of 5 county roads or portions thereof to the city of Cottage Grove. That's it.
That is it.
A second.
Moved by Commissioner and seconded by, I heard 2. Since I'm not looking for, it was audio that I was going to, so Commissioner Lovell, seconded by Commissioner Lovell. Discussion to the motion. I see no discussion. I'll call for the vote. All those in favor, please say aye.
Aye.
Aye. Any opposed? Passes unanimously. Thank you, Jay. Thank you, Mr.
Thank you.
Bonet. Good job. You made my work easy by giving me this easy script to read. Thank you.
Try to make it easy.
Then we'll move directly into item number 12 on our agenda, which is, and while people are getting in place at the panel table, I'll mention any of the items that the board is considering today, including the last one and including the current one. If you're watching online, click on View Material, which is on our board packet. You'll see the entire package that the board has considered prior to discussing this particular item. So, Mr. Mukarajski, I'm going to turn this over to you for your panel. We have a report and discussion on a quarterly progress update with unhoused population initiatives. Excuse
Thank you,
me.
Chair and Commissioners. Eve Gray, our Director of Health and Human Services, is here to lead the conversation. Of course, Kate Budd is here and will walk through the details of the presentation. Kate is our housing manager in our Human Services division. So, Eve, you want to take it?
Sure, and I will pretty rapidly turn this over to Ms. Budd because she is the expert in this area. For our new commissioners, normally this presentation, we've set some extra time for it compared to how we used to do it. So it tends to be a fairly interactive kind of dialogue, so you don't have to wait to the end of the presentation necessarily to ask questions. What Ms. Budd will do today is go through a number of different kind of vignettes and populations of individuals. So if you focus questions on the particular population we're talking about at that time, then it's likely we will get to others that you have questions about throughout the presentation. And of course, anything we miss, we're happy to answer at the end.
Thank you, Director Gray.
Thank
Anything else I should do to share the PowerPoint?
Tanya. Tanya's coming to help you out on this end.
Well done. Thank you. Make sure this is working.
Go to this one. Close enough. They're pretty sensitive. We have it next to your laptop.
All right. Well, good afternoon, Chair and Commissioners. It's nice to see you again. I am the Housing Manager at Human Services Division, and I oversee a number of different teams, including Coordinated Entry and Outreach, the Homeless Management Information System, Program Service Coordinators, which oversee our nearly 110 contracts that we have with different providers throughout the community, the Rent and Energy Assistance Team, and also the Veteran Program Team. Today, as Eve mentioned, I have the opportunity to share a number of vignettes with you regarding folks who were houseless in Lane County, who have now since moved into either emergency shelter or a permanent housing program. I'll also share with you an update regarding the FUSE program, which is the frequent users of system engagement. And then also talk to you about the reimagining process that is happening through a contractor and focusing on the Poverty and Homelessness Board as well as the Human Services Council, which are two of the committees through the Human Services Division. So the first vignette is regarding a woman named Sarah, and she is a senior, and seniors make up approximately 25% of the overall population of people who are houseless in our community, and that does include families with children. Sarah lost her husband approximately about 15 years ago, and when that occurred, she was living just on his Social Security, and quickly realized that there wasn't enough money to continue paying the rent in the unit that they were living in. And she also began a pretty significant substance abuse challenge. She started living with family and friends and unfortunately quickly burned those bridges and moved into a trailer in the community. There, her substance abuse continued to increase, and she also developed a heart challenge that was diagnosed in the many times that she went into the emergency department. It was a place where she felt safe and also a place where she could, make sure that the symptoms she was feeling was recognized by others. And so she quickly became what is often referred to as a frequent user of the emergency department. And as she became more known at the hospital, the hospital helped to connect her with different resources within the homeless services programs. And she was provided with an assessment that helped connect her with different resources for people who have been utilizing many different systems of care, such as the emergency department. And so after a number of years of, frequently using the emergency department and kind of going into different emergency shelters where she indicated that she didn't feel safe, she was fortunately able to get into the Navigation Center, which very much focuses on people with high needs, people with substance use challenges, and also folks who may not have found other emergency shelters to be suitable suitable for them for many different reasons. There at the Navigation Center, the staff learned that she was struggling with meeting her activities of daily living. And so standing up for longer periods of time was a real challenge for her because of her heart issues. She was not eating anything that resembled a healthy diet while she was living on the street and in the trailer. And so they began working with her to be able to change her diet and also to connect her with other resources such as aging and disability services and having an assessment for potentially going into an adult care facility or a foster home. One of the greatest challenges that we find with folks who are houseless is that they may qualify for those types of services, but that foster homes and adult care homes are able to choose who it is that they welcome, and that often folks who are houseless and dealing with whether it's substance use challenges, mental health challenge, or potentially both, are not often welcomed into care or foster care facilities for adults. And so we are continuing to advocate for this individual to be able to go into that type of facility, but in the meantime, they remain in the Navigation Center, getting as much support as they can for her. So to add a little bit more context to Sarah's story, this is a visual chart of the number of people experiencing homelessness in Lane County who are over the age of 56 and older. So the blue represents those 56 to 64 years old. Those in the orangey red are over the age of 65. And we do have a significant population of people who are seniors. What you may see is that it's not a significant increase in the last 3 years, that we've just continued to see growth, but not significant growth, and that it does continue to rise as we look over the last 3 years. And when talking to seniors, what we often hear is that they're on a fixed income and that their income is not rising at nearly the rate as the rent that they're paying. And then when someone may need to move out of a rental unit, it often then means that they're going to family or friends' homes. And if someone has a mental health challenge or a behavioral health challenge or both, it means that it's very hard for them to be able to stay on a long-term basis. And so we hear kind of story after story where folks have burned out staying with their support systems and now are living on the street. Another visual is comparing the average annual fixed income compared to the income needed to afford a one-bedroom unit. And so if we think about Social Security and kind of the lowest level of Social Security that someone might receive, it's a little less than $10,000 as of 2020. Veterans pension on average is about $16,000, and then retirement on average about $18,000. And if we compare that to the income that someone needs to pay approximately 30% of their income to rent, someone would need to make approximately $36,000. And so it doesn't mean that it is impossible, say, for someone who is receiving the average retirement income to live in a one-bedroom unit, but it might mean that they're paying closer to 70, 80, 90% of their income to rent, which then makes it much more difficult for them to remain stable. And the school of thumb is basically if someone is paying 30%, then that's the greatest level of stability and the ideal. I wanted to share a quick story regarding this. I was making a presentation regarding Social Security and how, as a fixed income, it doesn't rise nearly at the rate of rent. And I had a woman come to me and say, make sure every time you talk about Social Security that you also talk about retirement. And she said, I thought I did everything right. She worked for the railroad. She was an administrative assistant for her entire career. And when she retired, she thought, she would be fine and, be able to hike and enjoy her community. And she said she quickly found out that on her retirement, she couldn't survive and pay for the rent that she had, and that she actually had to go back to work because her retirement wasn't enough money to survive and remain housed on. So I always like to add the retirement piece in there because of her and her assertiveness. So regarding Sarah and thinking about policy opportunities to help support her and others dealing with similar challenges, Oregon Housing and Community Services, which is the state entity that my team works most often with, has a budget option package, one related to keeping Oregonians in their home, which extends previous one-time investments that include rent assistance, legal services for folks who are experiencing evictions or dealing with landlord tenant challenges, and then also mediation services to help both landlords and tenants be able to separate without having to actually go to an eviction process. There's also a budget option related to shelter for Oregonians and data improvement. And this is an opportunity to continue receiving dollars to support emergency shelters, which we know that there's continuing need here in Lane County for that type of support. And also dollars to expand the capacity of the homeless management information system at the state level and build capacity locally. And we know that data is incredibly important when it comes to addressing homelessness. We need to understand where we are in order to be able to move forward in our desired outcomes. And so we know that investing in the homeless management information system is a value add. We also want to make sure that the Medicaid 1115 waiver is implemented in its rules as flexibly as possible. This is an amazing opportunity to increase resources available to address homelessness. There are dollars that could provide rent assistance, dollars that can help provide move-in cost assistance, and the rules are being developed now. And so we want to make sure that they're being developed under the eye of how can we best support people who are houseless or at risk of losing their home. We also want to look at the reimbursement rates for adult care providers and assisted living facilities. I mentioned that right now those entities can choose who it is that they serve. And there's been success in other states that if the reimbursement rate is higher for folks that have previous houselessness or for those who have behavioral health challenges, that they're more likely to be housed in that type of support. And then also increasing staffing for aging and disability assessments and supports. We are seeing more and more within our homeless services that the need for aging and disability supports as well as appropriate assessments are increasing. And there's not enough staff to be able to have those assessments done in a rapid manner so that those needs can be met. So we have a second vignette for Harim, who is a gentleman who left home, I should say was exited from his home in his early teens for coming out as LGBTQ. He, from there, developed a pretty significant substance abuse challenge, ended up in an accident where now he is a person in a wheelchair and had been a pretty frequent user of the jails and engager of the police across Lane County. This gentleman was someone who was engaged by our youth outreach, and just they continued to get to know him, continued to help meet his basic needs, and that helped him open up to receiving more assistance. And through the outreach team, they were able to connect him with a youth shelter, and now he is in the process of getting into a permanent supported housing program due to the very high level of need that he has, both through behavioral health, physical health, and his frequent use of jail and health care. So a few points of interest just related to Hareem's situation is that based on self-report, approximately 63% of folks who identify as an adult as well as are utilizing our homeless programs identify as having a disability. And we actually think that that's an underreported number, that there are some folks who may choose not to say they have a disability or that they may not realize that they have a disability. And that about a third of those residing in Lane County who are renters are paying more than 50% of their income. And that was something that Hareem also was greatly challenged with himself as someone who's just on Social Security and trying to find a room or somewhere else to rent. We also know that approximately 100 families who are low income for every 100 families who are low income, there's only 16 affordable housing units available. And that's based on 2020 data. And so we can presume that is actually decreased in the last few years, particularly due to COVID. And so it is extraordinarily difficult, even for folks who have very few barriers to be able to find a rental.
Ms. Budd, Vice Chair Trieger.
Thank you. Just a clarifying question. For every 100 families with extremely low income, 16 affordable units available. Is that, I'm guessing that is both a number of front doors as well as the affordability of the rent of those doors. It's a combination, right? It's not just an inventory problem, it's the affordability of the inventory.
It is, very much so. Yes, and it looks at that rule of thumb of the 30% to looking at the overall inventory.
Thank you.
So another graph that may be of interest is this is looking at Social Security versus housing costs and the kind of low minimum point of Social Security income. And I started working in homelessness services nearly 15 years ago. And I remember when I would work with a client to get Social Security and they received it, I was ecstatic, as were they. But I could realistically work with them and be able to get them into housing. And that was, something that was amazing, and it helped that individual be able to gain additional independence and autonomy. The challenge now is that even when someone gets Social Security, it's very rare that they're able to find housing that they're able to afford, especially without spending 70, 80, 90% plus of their overall income to afford the unit. And so looking at this chart, you can see if we look at 2023, that if someone's getting the minimum SSI amount, they simply have $12 left over if they're paying the fair market rent of an efficiency. And so that's simply a room, often with a kitchenette and a shared bathroom. And so it unfortunately is no longer realistic that someone might be able to find a unit to rent that's affordable to them when they receive Social Security. One other thing that I thought was very interesting when I was pulling this data is that Lane County has the second highest number of Social Security income recipients in Oregon, second only to Multnomah County. And so what that tells me is that we have more people that are experiencing a disability than even Washington and Clackamas counties, and that they're folks who are, challenged in their housing stability, and that it is not necessarily a surprise that we are seeing an even more increasing number of people falling into homelessness as we move out of COVID and as we continue to focus on kind of this new era that we have post-COVID. So a few policy opportunities related to Hareem include a budget option package around permanent supported housing. This provides development funds coupled with resources for supportive services to be able to support additional permanent supported housing units. I will share that permanent supported housing has two different models. One where it is what we call site-based, which the Nell or Martin Luther King Commons is an example of. And then another that we call scattered site. And scattered site is where the programs that are providing permanent supported housing go out into our community and work with their client and landlords to rent permanent supported housing. And we actually have over 200 permanent supported housing units throughout Lane County, with folks who have extraordinarily high needs residing in those. And so we do have many permanent supported housing clients and units that are supporting individuals, and the opportunity to continue to provide more is certainly one that we're looking for. Oregon Housing Alliance advocacy agenda. They're looking for eviction reform and reduction, as well as looking for a reasonable rent. So what would be a percentage that rent might be able to be capped so that individuals can rely on not having their rent increase too significantly year after year. And so that may be a policy opportunity for this commission to look at. Also looking at advocating for supported employment at the state and federal level. Supported employment is something that is offered to people who are looking to come back into the workplace and often have a disability. And it provides coaches so that they can actually go into the workplace and help someone understand what their role is, help them advocate to get answers to any questions that they might have, and also just help them kind of move into their new role without it being too overwhelming. Also looking at supporting transportation investments across Lane County. More and more people who are experiencing low incomes are relying solely on public transportation. And as the different housing options become further outside of the city, especially those that are affordable, it makes it more difficult for people to be able to access transportation to get to where they need to go. And then lastly, just advocating for more flexible, non-traditional support models within behavioral and physical health, as well as accessing probation and other programs that people may need to have as a part of their life, but really struggle with that they have to be somewhere at 10 a.m., for example. So the third vignette is Mary Bell, and she is a single mom with 2 kids, one of who has a disability. Mary Bell is Spanish speaking and is someone who has a full-time 40-hour-a-week job doing dishes at a food establishment. She lost her job during COVID. Also, the child care facility that her kiddos were going to closed. And so she's been working to reconnect with both childcare and job, as well as was able to get into a rapid rehousing program. So her own rental with supportive services from a nonprofit after living houseless for approximately 3 or 4 months. So she has really been struggling to find a job that is matching the childcare options that she continues to find. Working in the kind of food business, she finds that they often close 9 or 10 o'clock, and it's very difficult to find childcare for that hour, and then also very difficult for her to find an employer who's flexible enough to allow her to leave work should her son, particularly the one who has a disability, need her and she gets called home. And so unfortunately, it means that she's lost a number of jobs as well because she needs to leave at the turn of a dime. And so the Rapid Rehousing program is really helping her be able to gain additional stability and looking to connect her with culturally specific agencies such as Centro to make sure that she's getting what she needs and is stable for the long term. So this chart right here shows the number of people and families experiencing homelessness in Lane County. And this is one that I was very surprised by, to see the sharp increase in the number of families who are houseless. And what we see here is that in the past approximately 3 years, there have been many more families who have fallen into homelessness. There was a bit of a lull between January 2022, July 2022, and December, which, talking to families and staff, is attributed to the eviction moratorium, and that families were able to stay in their units without being evicted. But now that the eviction moratorium has ended, we're seeing a sharp increase in the number of families who are houseless. And that is not only county-wide, but very much so within the different communities in our county. Florence, represents the smaller communities, so, Mapleton, Cresswell, et cetera. And so this is something that we're paying very close attention to. We're hearing this from community members just anecdotally, and working to increase the number of shelters options that are for families, as well as rapid rehousing options to get them into permanent housing as soon as possible.
Ms. Budd?
One other quick question. What are you using for definition of families in this instance?
Sure. And so it would be anyone that has a head of household over the age of 17, so someone who's 18 or older, who has a child who's under the age of 18.
Thank you.
So regarding childcare challenges, the top employment industries, as I'm sure you're well aware, are industries that do not match well with the child care options, particularly food service and ambulatory health care services. And the United Way did a study during COVID and found that approximately 37% of child care providers left the field during the pandemic, and that alone is a significant loss. But they also shared that over 50% of those who left the field were not planning on coming back when COVID ended. And so that I think helps to illustrate the severe challenges that families are having related to childcare, as well as the numbers on the right that shows the number of childcare slots available per 100 children under 13 years of age. And while Lane County ranked number 7, there is a pretty significant difference between number 1 and number 2 as far as the amount of childcare slots when compared to number 7. And unfortunately for other counties, it only gets worse from there. But it certainly illustrates the need for more childcare options, and particularly those who are able to serve children with special needs. So this chart shows the annual wage needed to afford a fair market rental unit in Lane County. And so again, that rule of thumb of 30% being ideal. And then this chart shows what someone would need to make if they were just paying 50% of their income or 60% of their income. And so this is compared to if someone were actually working 40 hours a week at a minimum wage here in Lane County, or receiving approximately $28,000 annually. And so what you can see is that it is realistic that someone working full-time could afford a one-bedroom unit if they were paying approximately 50% of their income. If it were someone like Mary Bell with kiddos, she would at least need a two-bedroom unit. And so she would be paying at least 60% of her income to be able to afford that unit, which is very challenging. So a few policy opportunities related to Mary Bell's challenges include the CARE Act, which is another budget option through Oregon Housing and Community Services. And this is an opportunity to co-locate affordable housing with childcare facilities. And this is something that's becoming more and more common through affordable housing development, and frankly makes a lot of sense. If a family is able to get up, get ready, walk out the door, and walk right into the childcare facility, there's a convenience, there's a safety and kind of just security factor of knowing the neighborhood and having the childcare provider as a neighbor, and then also just a cost savings because someone needs to ride the bus less, and also needs to not travel to childcare, which is good. It saves time, and that's positive. So hoping to see more of that. And then also the Oregon Housing Alliance has an advocacy item regarding allowing tenants to have home-based childcare. And that too would simply open up the opportunity for additional childcare providers. If someone is a home owner, many are able to independently open up as a child care facility if they follow the local rules and requirements. But there are others who live in apartment complexes, for example, that through the lease are not able to provide child care. And that would be even if it were just one or two children. And so this would just increase the capacity of child care. Also looking at investing in additional career growth opportunities. How can we help Mary Bell move beyond dishwashing and doing other types of roles in the food industry? Providing additional affordable housing, of course, would be a benefit to her, and then also that non-traditional access to behavioral and physical health services. So the last vignette, this is Jane, and Jane is someone who has experienced homelessness for nearly her entire life. Jane has experienced schizophrenia in her 20s and continues to deal with those symptoms. Also pretty significant substance abuse challenges. She, due to her mental health, has significant anger and aggression challenges, and so lands herself in jail on a regular basis, and also finds herself in the emergency department quite often, and engaging with the homeless street outreach programs. She also has vision challenges, and so that makes it difficult for her to feel safe in many environments. And she also has heart challenges, which means that she really struggles with walking long distances or being able to talk to folks for a long period of time. Jane became someone who's on the FUSE program's radar because of her frequent use of different systems, and continues to be in a FUSE program today. And so I want to tell you more about what that actually looks like as I transition to an update regarding FUSE, or frequent users of system engagement. And so this is a SAMHSA grant that Lane County received to support this model, which is one that's been adopted across the country and many different types of communities. The FUSE model has three primary focus areas. The first being data-driven problem solving, very much collecting data from all the different systems that are partners. And so from the jail, from the justice system, from both of our CCOs in the community, from the healthcare fields, and looking at who very much is using these different systems of care at the very highest levels. And then looking at policy and systems reform. So how can we work together to see a reduction in overall use of these services, which equates to a reduction in the overall costs, and also equates to better health for the individual. And then also targeted housing and services. We know that better health is often found with housing, with very important supportive services as well. And so this program does come with dedicated beds, both with emergency and permanent housing, which I'll talk about in a few minutes. So this is an example of the type of data-driven targeting that's done as a part of this program. There are many people that if you look at just their justice involvement, look at just their involvement with emergency departments, for example, they may not be identified as a frequent user, but if you start to look at it all collectively together, they very much are, such as this individual illustrated. And what often we see is that they're utilizing all three of these different systems pretty heavily. And so this program screens people in to work to reduce their overall use, to get them housed, and to help improve their quality of life. So the FUSE model has kind of three important legs that it stands on. First and foremost, better outcomes for all these different systems of care, as well as the individual themselves. Reduced inefficiencies. We want to make sure that the recidivism rate for individuals is lowering, and that the stability of individuals is rising, and then increased cost savings. We need to be able to justify providing this program long term, and that indeed there's a reduction in overall costs. It's an illustration of the many community partners that are a part of this program. We think that this is one of the highlights of the program itself, and that it was able to bring together these diverse partners regarding a shared goal of simply helping our clients. The referral criteria for FUSE is that someone needs to be literally homeless, so they're living in a place that's not meant for habitation, or in an emergency shelter or an alternative shelter in the community. And then they need to have high utilization, and so that could be just related to criminal justice with arrests or jail bookings, could be specifically related to emergency departments or inpatient visits, or it could be a collection of all three. And what we found is that the majority of the FUSE clients very much do have engagement with all three entities. So what FUSE offers is first and foremost outreach, where there's a dedicated team who is provided with the name of someone who is a high utilizer, and they go out in the community and work to engage them and really get to know them, get to understand what makes them tick, what motivates them, and how can they work together, first to just make sure that their basic needs are met, but secondarily to help work through the barriers that they might have to moving into an emergency shelter and or moving into permanent housing. And there are some people who may have no interest in emergency shelter. And so then the focus really is on permanent housing. If they're willing to move into emergency shelter, then how do we move them from the shelter into permanent housing? We have dedicated units for FUSE clients, including 10 emergency shelter beds that are there for those individuals, 13 rapid rehousing slots for folks, and then 64 permanent supported housing units for these folks. What is an amazing addition to these housing options is that there's a housing choice voucher that's tied to this permanent supported housing clients. And so if someone does indeed stabilize and they no longer need intensive supports, then they're able to receive a voucher and either stay in the unit that they're residing in if it's within the community, and just simply receive rental assistance ongoing, or that they can move out of, if they're living at the Nell, they can move out of the Nell and then move into a community unit. And so it helps them remain stable long-term. So regarding data about Fuse, what we are pleased to see is that if we look at the number of times that someone engaged in these different systems 6 months prior to entering Fuse, and we compare it to an individual who exited and 6 months later from Fuse, then we've seen a decrease across the board in their engagement. And that is for everyone who's engaged in Fuse. They're kind of in the middle column, and then also specifically for folks who reside or resided in MLK Commons. Another chart here is for the actual dollar savings regarding Fuse. And again, this is that comparing 6 months prior to engagement with 6 months after program exit. And we saw cost savings across the board, but most notably in inpatient care. And that makes sense. If we think about when someone is housed, their health is not deteriorating on a daily basis like it is when you are literally unhoused. And so we saw a notable cost savings. I will note that even with the connection of MLK Commons, that not all Fuse clients go into MLK, and not all MLK residents are Fuse clients. And so there are folks who go into MLK Commons who very quickly show that they are not someone who should be living there, and they are very quickly exited. Unfortunately, we are still learning who is the best fit for MLK Commons. Notably, we have one program through Lane County Behavioral Health where we're seeing, because of the extreme severity of their behavioral health symptoms, that MLK Commons just isn't a fit. And so we're continuing to understand that and adjust the eligibility criteria as necessary. So I've got a couple success stories regarding Fuse clients. I'll move to this one regarding James. And what I think about this story that's so compelling to me is that this gentleman was screened in to Fuse while having an intellectual and developmental disability. And that this person was so engaged in all these other systems that it took for him to actually be recognized and placed in the Fuse program to get the resources that are very much his right to receive as someone with an intellectual and developmental disability. And that is a reality that sometimes folks, they may continue to reach out for help, but we may not realize that there's, an underlying challenge that they're dealing with, and that there's additional help and support that we can connect them with. And so I'm really pleased to see that he was connected to these additional supports, and that there was recognition that it wasn't just simply a behavioral health challenge that was affecting James. And so he learned significant skills during his time in Fuse, and that is often a high need among those served in Fuse, that those skills, how to write a check, how to pay rent on time, how to keep house and clean and eat healthy, prepared food are not skills that folks have if they've been experiencing homelessness for a long time. And so that's a significant part of the support provided to folks, both in permanent supported housing as well as rapid rehousing, is just learning those key basic skills that I know I take for granted. James exited the Fuse program after significantly stabilizing and received an emergency housing voucher, which is similar to Section 8, and now resides with ongoing rent assistance and a staff member that checks in with him every 3 to 6 months. So very exciting. So now I'm going to transition to the reimagining process that is occurring with 2 of the Human Services Division committees, specifically Human Services Council and the Poverty and Homelessness Board. And the focus of this reimagining process is really to develop clear recommendations for the future of 2 interrelated Lane County boards and commissions. Specifically, the Human Services Council is an intergovernmental body. It's made up of 3 jurisdictions, the city of Eugene, Springfield, as well as Lane County, and it has oversight for many of the human services investments that are made within Lane County. The Poverty and Homelessness Board is an advisory committee to the commissioners, and one that serves as the Continuum of Care Board as well as the Community Action Board. And these are 2 federally specified boards that anyone who receives specific funding needs to have. And so it also comes with very specific rules and requirements. And so what we've found over the past few years is that these groups commonly have participants who are just asking, what's the difference? And that they tend to go to both, and that they tend to need updates between one another. And so the contractor that we're working with is reaching out to key stakeholders, including many of the participants within these 2 groups, to ask, if you had a magic wand, what would you do? What do you think would be ideal? What are the key strengths of these committees? And how do we kind of rethink them to make the best possible committee or committees moving forward? And so what you'll see here is the timeline for the identified activities. They're going to talk one-on-one with those key stakeholders this month and next. They're going to be providing a survey for those who may not be able to have a one-on-one conversation. And then come in April and May, there's going to be a report developed that provide recommendations for both of these committees to consider. So we're really pleased to have this opportunity to just hit pause and be able to reassess as to whether these 2 committees and their current structures are the best ways to go, and to potentially be able to create something that might have even greater strengths than the committees have now.
Well, thank you, Ms. But I, for one, am pleased with that pause button that you're talking about. I'll tell you why later. First, we'll look to the queue from the commissioners regarding questions, comments. As historically, on this particular presentation, we've extended it because there historically have been a lot of questions. So
I kind of digest some of this information.
Very thorough, great job.
Yeah, great job.
I can chew for a while. It looks like Vice Chair Trio's ready.
I'll just get us chewing a little bit. There were several really impactful graphs that you shared, going back to the one about Fuse system changes. That one really stood out to me, particularly jail days, basically 62% decrease in folks who have lived at the Commons with their interaction with spending time in jail. That's phenomenal. that's a success. All of those percentages are really telling and really important, but the jail bookings and jail days really shows us that when we give people the basic needs and supports that they need and deserve, they're really not appropriate to be in the criminal justice system, and so I really like that. Going back a little bit to the Social Security and retirement, I assume when you're talking about Social Security, you're mostly talking about like Social Security disability. I think of Social Security, right? I have the luxury of thinking of it as the long-term retirement benefits that we all pay into, the federal government retirement program. So do you mean people securing those benefits? Are these folks who are over, who are in their mid to late 60s or older to actually get those benefits? Or are you talking about more like Social Security disability or Social Security for folks with other needs? Can you just
Sure.
clarify that,
So
and then
with
I'll
this
say
one,
my
this
next
is the folks who have a disability.
Okay.
Who, may receive them in their, 30s, 40s, et cetera, haven't yet reached that retirement age.
And so just, this isn't really a question, but just a point, similar to when we had our leadership team with budget kickoff, there are some really, I think when you dig into things like this and unpack them, there are categories within these categories that are disparately impacted, right? So we know, for instance, splitting across gender lines, way fewer women have adequate, if any, retirement savings, for example, because we tend to be the ones that don't work outside the home to fulfill caregiving roles, work lower wage jobs, work part-time jobs, and so on. So it would be really interesting, in your spare time, but sometime to maybe give some examples of teasing out different demographics and populations to really highlight or daylight those disparate impacts on the systemic problems that we have in our culture around gender, around race and ethnicity, educational attainment, so on. So that's, as I said, not really a question, and more of an observation. The last thing I wanted to ask you about, at least for the moment, is those policy opportunities that you listed in different areas. I'm really curious in the organization here at Lane County cross-departmentally, if you're working with Steve Adams' shop, or where or what we might do to take some of those concepts and dig into them a little bit and see what's viable. For instance, things like evictions reform and reasonable rent policies. It would be great if we had those, but we don't necessarily have the jurisdiction to do that for the county as a footprint. And how many rental units are really in unincorporated Lane County? Not none, but really the significant place to dig into that is places like the Housing Policy Board, which I know is looking at such things, but that's just City of Eugene. It leaves City of Springfield out, or Cottage Grove, or Oak Ridge. So broadly, those policy opportunities that you talked about, transportation investments, the childcare issues, where as an organization, and this, I could be looking at our administrator for this as much too, where and how are we taking those really important concepts and sort of digging into them to see what we could actually be doing?
And I can share that we do have the opportunity to work with Steve Adams as well as Alex Kyler regarding the Lane County policy agenda for the state legislative session. And I think what is exciting to me is that, we have an opportunity to bring in, different agenda items and have conversations related to, what do we recommend for the county to consider.
Great, thank you. Yeah, and I guess, that makes total sense, and I would assume so. But, whether the things that we can do within our own jurisdiction, not in addition to policy recommendations and lobbying and advocacy we do at the state. And I know our capacity is limited, and we tend to focus our legislative advocacy at the state on things that are more directly tied to the operations of Lane County, and some of these are more systemic structural community issues. So whether there are things that we could be doing as an organization to advance some of these policy solutions. I know for, a really specific one, you talked about the transportation investments, but also, and childcare, but also food access. We heard a recent report back on the Four Corners property, and we had this fabulous vision for a partnership there with Homes for Good and sponsors, and some of the federal resources weren't available to us because that area is identified as a food desert. So it's in that terrible catch-22 of there's no grocery store because there aren't the residents to support it, and then you can't secure the federal resources to build the residents because there's not good food access. So are there things we could be doing, whether it's through our economic development shop or what we could be doing that we have sort of more agency over in addition to the lobbying state and federal legislators.
Yeah, and I think we're happy to sit down with the various recommendations that Kate made here, and I think it was nice to see them pulled out in addressing different and specific populations, because there are different barriers and challenges that each population faces. So we can certainly look with Steve and Alex to start to identify where each of those could be addressed, and of course, if there is anything that's not already addressed by our legislative policies and priorities document, we would want to take that to legislative committee and just make sure that we go about the process of assuring that everyone's on board with the recommendations. So I think we can take that as a follow-up.
Great, thank you. And then the last thing it just occurred to me, I know City of Eugene has been looking at developing they're exploring some new policy language around creation of public health overlay zones. So it's a zoning issue that then incentivizes things like full-service grocery stores and farmers markets, and also addresses, polluting industries and their proximity to residences and so on. So there are some local municipal level policies, I think, that we could look at, as I said, in addition to the work we do at the state and federal. With our state and
Absolutely.
federal delegation. Great, thank you.
Thank you, Vice Chair. Further questions? While I wait for further questions, I'll tell you why I like the pause button. You've probably been just hanging on the edge. I've already told you. The Poverty Homelessness Board and Human Services Commission, the main difference at face value is that one is intergovernmental and the other is multi-jurisdictional. While the Poverty Homelessness Board does have, for instance, the Mayor of Eugene and the Mayor of Springfield on it, it's not funded by Springfield or Eugene or any other jurisdiction, fully funded by Lane County. And consequently, there's a kind of a heavy load on Lane County staff for the Poverty and Homelessness Board work. And the Poverty and Homelessness Board work tends to be quite a bit bigger, in fact, than the Human Services Commission work. I know this because I served on both of them from the outset of Poverty and Homelessness Board and with the Human Services Commission since 1995 with a little gap in between. So I do know the differences between the two. And the pause that you described right now is a chance to look at the two and see if and how a merger could occur so that one board potentially could cover the entire mission of both boards and the purpose of both boards. I personally think I'm optimistic that it can. I am quite optimistic that it can. And if that does happen, then we'll have multiple jurisdictions contributing to the operation and the work and the mission and the strategic planning of a single board. And that's a problem that we have with Poverty and Homelessness Board today, is that when, for instance, the Mayor of Eugene comes, the Mayor of Eugene wonders, how does this apply to my work and to my staff's work? And the answer is, well, look at the numbers. We all look at the same numbers, and that's about it. But the work through it, using an outside contractor to really take an aerial view of everything, I'm pretty optimistic that we're going to move forward with that. That's why I'm pretty happy with the pause button at this point. At first I thought, do we really need to? And then when I really looked, and Kate, when you really explained to me what we were doing, I got to tell you, Kate's explanation is worth 1 million volumes of an encyclopedia. You really helped me to fully understand and help you to work with other members. And right now, the leadership of the Poverty and Homelessness Board has taken a new direction in that it really is working with the future of both commissions in mind. The Human Services Commission used to be the Continuum of Care and the CAA, Community Action Agency. And that when we created the Poverty and Homelessness Board, they shifted over to that. And so it became the Continuum of Care and the CAA all of a sudden were Lane County boards and not multi-jurisdictional. Now, they are Lane County. We're the ones that are charged to have those by the federal government. However, when it was multi-jurisdictional, there was a little bit more stake in the input that other jurisdictions had. That's why I'm excited. So now, does anybody else have more before I go on? Commissioner Laval.
Thank you. I'm going to take a stab at this because I'm processing so much information. Kate, you're a world of knowledge, and I appreciate that. I think the thing that struck me as I'm sifting through some of this information and some of your vignettes with Harim and those folks is just some of the references that we have to landlords and the responsibility of landlords, and sometimes they get villainized for no reason. So I'm here maybe just to say to the landlords that a lot of the landlords, probably 80% of the landlords are mom and pops. They own less than 2 properties apiece. So we're talking about people who, if there was an eviction moratorium and the people didn't pay the rent, they were struggling to pay their mortgage, and so there's this double-edged sword to how to house people. The other thing too is we just have too little units. I mean, that's just a fact, right? Even if we could put everybody in a home, we couldn't because we don't have enough infrastructure. So I guess the thing that I'm wondering is because you're such a creative thinker, and I appreciate that about you, is there any shuffling of ideas to incentivize landlords to buy into this vision? Because for the most part, landlords are like, hey, Section 8, all this kind of stuff, they get all weary because they don't want their properties messed up because they can't afford to fix them with what monies they get back, et cetera. So I'm just wondering if there's something we as a board can adopt as a countywide incentive for people to sign on to this relationship, because that's what it's going to take. We can throw money at this all day long, and we're not going to fix it unless each one of us care enough to get involved. So I'm just wondering if there's an idea that you think out there for landlords that might help.
Yeah, thank you. And I want to echo what you just shared, that landlords are a key partner in the work that we do, that we can't effectively house folks without landlords and their willingness to continue to rent to people within our community. And so we too don't seek to villainize landlords, and actually are fortunate in that within my team, we have a landlord liaison. And right now, they are working with a University of Oregon team to create a survey for landlords. And we're very fortunate that the Lane County Rental Association is willing to share that survey with their members. And the focus is going to be on what type of incentives might actually work for you as a landlord to consider renting to someone that may have, higher barriers than others. And so we're looking forward to getting that feedback and then considering what type of program we might be able to create. We've seen in other communities that just simply providing, $2,000, $3,000 to a landlord if they're willing to take a chance on someone engaged within one of our programs does motivate landlords to be willing to rent. And so we're interested to see if that actually is the case within our community, and we'll learn more through that survey. So I think we'll likely even get more creative feedback than what I could come up with from the landlords, and hope to be able to operationalize that.
Yeah, if I could add just one more thing, that I think your risk assessment, aversion, and understanding are two pillar pieces to this puzzle. I mean, if I can just share a quick story, we had a tenant come in and she was there 2 days, had a total meltdown breakdown on the streets of Main Street, and got kicked out of every restaurant and business in there in one night with her and her friend. So our knee-jerk reaction was fear, protect all of our other clients, was to say this needs to go. But something spoke to me deep that said, maybe there's an underlying problem I'm not familiar with. So we met with this individual, found out that she was running from an abusive relationship, found out that that person had called her that night and she flipped out. But having that level of understanding and then having a mutual understanding between us and the client, landlord and client, we were able to establish a restart, if you will, and she's been a model tenant ever since. So I think those kinds of success stories I think are important, but a lot of landlords don't want to get involved in the process of healing with people. And I think that's the issue that we need to face is we're going to help people as humans and humanity. We need to be there for each other. And sometimes that takes risk. So I appreciate that. Thank you.
Thank you.
Do you want to speak at all to damage mitigation funds and how that's been done at the state level and kind of where we are?
Sure, absolutely. And so there is a damage mitigation fund at the state level for landlords who are willing to rent to folks with vouchers. And I actually have heard that that's very underutilized by landlords. And so I hope that will pick up. But we actually have a mitigation fund here in Lane County, also for landlords who are willing to rent to folks within our different housing programs. And what we found is that when a landlord does sign up for that mitigation program, very rarely is there a need to pay out any type of mitigation funds after the 1-year period of tenancy, which we're always pleased to see, but also glad that, if that motivated the landlord to be willing to rent, that's important. And, Commissioner Lovell, the other thing that I thought of when you you shared your point, is working to have additional service providers available, in that, landlords may not be interested in getting involved, like you said, in the process of healing. But if we have staff who are, that landlords can call, that is also valuable. And we're looking at how we can help develop that further.
Absolutely, yeah.
Thank you, Commissioner. Commissioner Buck?
Yes, thank you.
Please, thank you.
I just want to clarify something specifically when you talk about vouchers. I want to be really specific about the type of vouchers you're saying, because landlord-tenant law requires that any landlord accept Section 8 vouchers as a form of income to qualify for housing. There isn't an ability to say, I don't want to rent to somebody with a Section 8 voucher. That changed in law quite some time ago. So when we talk about the vouchers for alternative programs that don't have those same kind of protections for tenants, I just want to be clear so the public that's watching or listening don't interpret what we're mentioning to apply to Section 8 vouchers, because long ago that was made clear by the legislature.
Thank you.
Then I'll just add a couple of things and follow up. We may have more in the queue, but regarding the landlord's understanding why tenants are behaving a certain way, as in Commissioner Lovall's description. You and I last Friday went out to a place where it's a different kind of landlord-tenant. It's not a real landlord, not a real tenant, but the same kind of relationship. People were camping in motorhomes outside of a business. And the business owner went out to the people in the motorhomes and asked them questions as to why they were doing certain things, and found out reasons that they didn't use the trash containers, for instance, and the reasons that they disdained the sanitation facilities. And with a conversation between that landlord and those tenants, they were able to come to a mutual agreement, which really is a viable situation in that particular area out in West Eugene that you and I visited late last Friday. But that really is a key to it, is if we get landlords willing to and understanding that if they listen to their tenants, eviction's not the only route. In fact, that should be the course of last resort, because eviction is hard, and being evicted is devastating. So I really appreciate that example, because it really did kind of coincide with what we saw out on Pacific Avenue and in West Eugene last Friday. I'll look around because I would prefer to go last, but I don't always. Go ahead.
You're talking about something I was kind of...
Commissioner Seneca, excuse me. Go ahead's not the right cue.
And I was kind of thinking about, you mentioned Sarah, I believe, was the example. She wasn't allowed into housing after her transitional housing. Can you explain, isn't that the purpose of the transitional housing? Like, well, what step was missed there, or what are we missing for?
So with Sarah, it was really around her trying to get into a foster care home or the adult care home, and needing that higher level of support. And just that, unfortunately, because she was not presenting as I might if I were trying to get into that type of home, the foster care owner decided that they wouldn't welcome her in. And that's their prerogative, they get to, but it just means it's very difficult, even if someone qualifies for assistance and to be able to get into an adult foster care home. What we're seeing is that instead they don't have options that are opening up for them, and so they're having to reside in the homeless system, in shelters, in housing that we're not equipped to really serve that level of need.
Yeah, and I think one of the challenges about our system is how we separate mind and body so much, and even separate specific types of disabilities. So we have housing available for folks who have physical disabilities or who are older and experiencing physical disabilities related to that. We have housing increasingly available, not enough, not nearly enough, but for individuals who have a mental health disability. And also some, not nearly enough, for individuals with substance abuse challenges, and then others for individuals with intellectual and developmental disabilities. What we find, though, is that humans are more than these compartments. And each of these types of providers specializes in someone who is purely what they specialize in. And when you wind up with folks who have dual disabilities, they have mental health and substance abuse, they have physical disability, intellectual disability, and mental health problem, we can't find housing, because the programs are specialized to support only what they know how to do and not the broad array of how a human might present to them. And so that's something that we are continually working on, but just the way the systems are set up now, even reimbursements being separate in these different systems as if humans don't come packaged with all of these pieces. So there are some major systems barriers that we face in folks who have these multiple types of disabilities.
Wow. I'm trying to type that as quickly as I can. The broad array of how people present. What a concept. And, you know, that leads me into something that we're talking about, the relationship between landlords and tenants and potential landlords and tenants, and getting people to be more accepting of vouchers when it's outside of the legal system, or the reasons that people find that are inside the legal system but they don't accept the vouchers. How people present themselves. We have an example, and that was when Michelle Obama issued the challenge for jurisdictions to achieve zero homeless veterans. We took up the challenge. It's called the Mayor's Challenge. We took it up here in Lane County, and Mayor Piercy was the mayor of Eugene at the time. And it was Operation 365. And at the time, that was one of the main focuses, was how do we get the landlords to accept people who otherwise would not be acceptable. And it could be because of rental history, could be because of income, could be because of just a lack of, presentation. We had a number of tactics that we used that were pretty successful on that smaller scale that we utilized. One of it was the Mayor Piercy and I actually telephoned landlord agencies and talked to them personally. Sometimes that was all it took, but sometimes it takes more. So as we looked for ways to get landlords a little bit more understanding of I'm going to use the presentation of tenants, the presentation, whether it be physical or whether it be their financial or history presentation. That we do have history to look back on, and it is really an area that we can focus on and have a great deal of success, or have a modicum of success, not a modicum, a large modicum. So the other point that I wanted to make is the FEWS numbers that you showed. When we first did FEWS, after the first year of FEWS, I put together a PowerPoint presentation that I used pretty extensively, and that was after 1 year. So we didn't have much history, and that was a part of the presentation, was the caveat. This is 1 year of history. Well, I'm looking at the numbers 5 years later, and where we had 26%. The first year we had a 26% drop in emergency department use. We're now reporting a 36% drop, so the numbers went up. And down the list of the different areas that we measured, jail bookings, the numbers are about the same. But inpatient, we reported 55%, and now we're reporting 60%. So the numbers held. The FEWS numbers, it is a system that does work. We can demonstrate it historically through time, just based on your PowerPoint and the old one that I'm looking at that I did a lot of years ago. So that being said, bravo. I think we do know how to move the ball, and we're addressing areas where we can move the ball. There's a lot to say about this, so I'm going to look to the board again for any further questions that you might have. Okay, then Ms. Budd, anything you'd like to add before we say farewell? And I'll see you tomorrow, probably.
Just really appreciate your comments regarding the progress with FEWS, and want to recognize both my staff, Danielle Bautista, as well as the agencies that are providing the FEWS supports, both through outreach as well as the housing programs. These are not easy programs, and so these are staff who are very dedicated to helping those who are very much most vulnerable in our community. So thanks to them as well as the partners with FEWS.
Thank you. And Danielle Batista has been a stalwart. I mean, she has been my go-to for a long, long time because she makes things seem so easy to explain, and I struggle for words continually. I'd like to point out also that you had a number of slides that you called policy opportunities. And I think we should all print those out and hang them on our walls and look at the policy opportunities that we do have, because that really is the upshot of this presentation, is where do we have opportunities to move forward. So Director Gray, anything you'd like to add?
No, thank you all so much. It's always fun. I told you it'd be the most fun presentation you get all quarter. So do appreciate all of your time and investment in this work. It's really one of the most important initiatives we work on.
Thank you very much.
Thank you.
And that concludes this agenda item. You know, there's a picture in here, this picture right here. That, I mean, you look into people's eyes, you know.
Sure.
And how can you not?
Oh, sure.
All right, Commissioners, we'll move down our list, and the next item on our list is, let's just give it one moment for this to settle in. Then next item on our list, Commissioners, is Commissioner Business Announcements. Are there any announcements? I know you've been announcing things all week, so there must be announcements. Okay. No Commissioner announcements. Nothing you did this week that was cool? I mean, your first week on the job as Commissioners and there's nothing to announce, okay.
You don't want to hear about county code.
All right, then do we have any future board assignment requests? Commissioner Buck.
Thank you, Chair. This isn't regarding a new request. This is about a current assignment that's on our list. And it was in October of last year. It was a request from our board in general to have Commissioner or Director Bell from Oregon Housing Community Services come and present in front of us as commissioners. As was mentioned earlier, we had an opportunity, I believe it's been a week already, last week. Our staff, is there a problem? We're good? Okay. Our staff and myself were able to host Director Bell here with her assistant. And I believe that satisfies the underlying issue that we originally put this assignment on for. We were having some difficulty with disaster relief funding coming through Oregon Housing and Community Services. I believe the conversation that we had here addressed many of those. And at this point, I would recommend to the board that we can take this one off, but perhaps ask for a brief back from staff so you're all informed with what the discussion was had and where we're going from there.
Thank you. I would concur with that because I was a part of the request for Director Bell to come down, and a part of what I was looking for was making certain that she knew where on the map Lane County was. I think we can say for certain she does know on the map where Lane County is. So yes. I would agree with that. Very good. Any further announcements? Our agenda team request, that was actually a negative agenda team request. So. Then I'm going to go back to announcements really quickly, and we all get to use our bully pulpit every now and then. Today is a really big day around my household. Yoali Luz Anise Gomez is 7 years old today, our oldest biological grandchild. And so you got to be happy about that, right, Steve? When a kid turns 7. Anyway, that's my announcement.
Happy birthday.
All right, then with that, with no further commissioner business, do we have a review of assignments, Mr. Mokrahajski?
Just Commissioner Buck's request, and I'm sorry I didn't catch what assignment that was we're removing from the list.
The specific statement was invite OHCS Director Bell to a future Board of Commissioner meeting.
Okay, so we're going to remove that. Yeah, and we did that.
When we had her down, and we'll just get maybe a brief from staff for all of us. Could be email, could be in person instead.
And I think the request came when she actually came down in person to visit the Nell when we did the grand opening of the Nell, and that's about the time the request was made, because we'd been in contact with her, and there was some concern that there wasn't a free flow of communication, perhaps. She was new on the job, and as soon as Director Bell, Dr. Bell, stepped into the position, it became really evident that she is going to do a superb job of engaging the entire state. So, all right, that's it, Mr. Mokryski? Now, this morning we dispatched with both executive sessions, which gives us extra time this afternoon. With no further business for this Board of Commissioners meeting today, our next meeting is January 31st, Harris Hall, 9 a.m. We're adjourned.